I'd like to ask if anyone on the CCG board gets remuneration from the Shaping a Healthier Future project. If so, is there an issue of conflict of interest that has been recorded? So I thought I'd have a go at answering that one. To which Shaping a Healthier Future is run by the HCCGs in North West London. There are a lot of posts that are part of the Shaping a Healthier Future teams, and there are some members of this governing body who receive payment for the time they spend doing Shaping a Healthier Future. There is no conflict of interest because it's us. I think that is the answer to the question.
Vanessa?
Can I just say that we as a governing body have discussed that at length in governing body meetings where the minutes will be in the public domain as well. We've discussed that very issue.
Okay.
So sorry, just for clarification, I understand that you've decided there is no conflict of interests, but I think what Debbie's question was some people are getting remuneration because they're playing a role in the Shaping a Healthier Future project. Is that correct?
So we are using a lot of people's time to do Shaping a Healthier Future, and we are paying them for their time for doing that work. But it's no different to paying for the time of the members of the governing body to be on the governing body. Shaping a Healthier Future it's just like an extension of the HCCGs working together.
Yeah, no, I understand. But can I just, so for example, a GP who was working, as a GP would then get a proportionate reward for working on the Shaping a Healthier Future project as well, is that right?
So yes, it is, but it's the same as a GP being a GP and sitting on the governing body getting paid for that
They
too.
would receive a salary for the work that they undertook.
They do receive a salary.
They would receive a salary in the same way that they receive a salary for sitting on the governing body or for doing any other clinical engagement work.
And they wouldn't be able to be a full-time GP and hold another position, so they have to drop hours as a GP in order to take on another role. There are only a number of working hours in the week that you can fill in whatever role you have.
So there would have been a reduction in their GP salary, would there?
Yes.
So roughly the reward would be the same as if you were working as a full-time GP?
It would depend on the role that you have.
Depends on the practice as well.
Yeah, because not all GPs earn the same.
No, I understand. So but I was
We
clarifying about if you were playing a senior role and therefore reducing your hours, your pay would be roughly, your remuneration total would be roughly the same as if you were working as a full-time GP.
Within broad parameters, yeah. Within the parameters that different practices. We did a big piece of work benchmarking GP GP income and set all of the salaries that we pay to all of our clinical leads and governing body members in line with the benchmarking. So if the salary somebody's receiving as a GP is in line with the average salary, then what we pay them would be in line with that. Obviously they may get more or less depending on their practices.
I just have to be upfront. I think she asked that because we'd heard that some people were earning significantly more.
No. So you'll be able to see what everybody earns when the annual reports are published, because it's a statutory declaration we have to make.
Yeah.
Thank you.
And that'll be ready for September for the AGM, will it?
Yes.
I mean, I was going to say they've been published on the
Already on the
website.
CCG
They've gone through us.
Yes, I think they were published on. I had to be published by the 13th of June.
They've been on there for a while.
It's called the remuneration report, and it forms part of the annual report.
Okay. So on the subject of money, this is a question from Anne Drinkle, and it's in 4 parts. So I'm going to do it in 3 parts, so that because they're all a bit different. First part is, what was the management consultancy spent in 13-14, and what is the budget for 14-15? Can you break down the costs, and how many consultants is it over how many days? Claire.
At our board meeting, at a governing body meeting on the 13th of May, we published the final budget outturn position for the Shaping a Healthier Future programme. That included within it a full list of all of the management consultancy contracts which we had let. So all of our spend is there. So if you look on the website, it was agenda item 16 on the 13th of May. The Shaping a Healthier Future budget for 14-15 is the paper that was discussed. We don't explicitly set which elements are for management consultancy versus other types of spend. Sometimes we know that up front, sometimes that only emerges during the year as the piece of But again, the list of contracts we have set, we have let this year is again in the paper, so it's published in. Is it not? This is Monday.
Sorry.
Well, that information would be available.
Can I just hold on a minute? I just wanted to be clear. So last year's clear and is published.
Yep.
This year isn't yet set because we don't know. Is that a fair summary?
Yeah.
Okay, so there is some information about last year. This year's isn't set. Tony.
So I've got a lot of sympathy with this question. It is exactly what a question that I asked at the meeting where this was discussed. I think there are a number of, I suppose, reasons why there is quite a large spend on management consultancy, and one of those is around the cap that NHS England put on management budgets for CCGs, and to do with.
Sorry, as a slight caution, that's not entirely correct, and I wouldn't want to say anything in this meeting that's not entirely correct and might be a little bit misleading. So can we just
Can we have another explanation?
Yeah. So the reason we spend money on management consultants is partly because a lot of the advice they give us is very specific and has a very specific knowledge base that we don't have that skill set within our staff. Another reason is that the pieces of work are often fairly short-term pieces of work, and for us to find people and source them to come in for a short period of time would be very difficult. So those are sort of two of the key reasons why we use management consultants, for their skills and because they're one-off ad hoc short pieces of work.
Okay, now.
Can I just supplementary to that then?
Yes.
What are you doing about, you mentioned, I think Ben Westcott mentioned IT strategy. Is that ongoing? Have you come to any strategic decisions on that? And is that farmed out to management consultants?
So, who would like to answer that?
Daniel.
Sorry, I've got Daniel and then Tony.
So we have just appointed a director of IT for the 8 CCGs, who is a permanent NHS person. He actually has a background in IT, and we got him from Westminster City Council, where he was one of their directors. And we have made a very substantial investment in IT over the last year and this year to ensure that all the GP practices in all of the tri-borough area all have the most up-to-date IT system, which is called System 1. And we bought that from there's a government framework, a contract for all the IT systems, so we purchased it from a government framework. And the advantage of all the GP practices being on the same IT system is all about how we can deliver our out-of-hospital strategy, because it means GPs can communicate with each other. We have got the community nurses using the IT system. We're getting the mental health nurses to use the IT system. We're having conversations with the council about linking up with the council's IT system so that we can share health and care records. And we hope very soon to be able to give patients their own IT record on their iPhone, a care record, so that we can actually really deliver on the digital agenda and enable people to really look after themselves by being able to see their own health record.
So that's going to be is that going to be the equivalent of the PSR, the patient summary record?
It's much more detailed than the PSR.
So
the PSR
is the patient summary record out of the window, that concept now? Because they were going to have those and probably put them on smart cards or something like that.
So we're just going to do much better than the PSR. So
is this related to the Cerner information system
So
that's in Imperial College Healthcare?
No. So, Tony, let's answer that. Yeah.
So I'm the clinical lead for IT for Hammersmith and Fulham, and I work in a very collaborative way with the clinical leads from the other CCGs in North West London. We meet regularly together to try and move forwards on strategy. So the question about management consultancy, no, it's very much clinically led. We're working closely with Imperial on a healthcare information exchange, basically to allow patient records to move with consent across the hospital GP barrier. And that's one of the key issues that most of our patients face, is that their GP records aren't available at the point of care to
And so, and is there any tie-up as well? If somebody moves house and goes up to Newcastle, have you got automatic transfer, electronically transfer patient records? Is that nothing going?
So yeah, that's all part of the
Plan.
Yep.
Yeah.
So within a single hosted system, that can easily happen. All of the GP systems are bringing on board something called GP to GP, which basically allows automatic transfer from one clinical system to another.
Because I did hear a couple of years ago, it's probably out of date, that people were having to print up the records and being sent over manually, then be retyped into another system somewhere.
That's certainly the historical situation.
Yeah.
Probably within the next 6 months, that will be history.
You mean across the country?
Across the country.
So the time scale is, say, the end of the year sort of
Should
time
be.
scale?
Yeah. So all of
really
all
electronic
of
transfer,
yeah,
all
of the main
between there.
GP systems
Good Lord.
are going to be doing that.
Okay.
I've heard from a radiologist that the Cerner system at Imperial is so difficult, so full of glitches, that she would rather spend 10 hours a day working with patients in order to avoid having to do all the inputting.
So,
The Cerner system is not fit.
So obviously Cerner is a system owned by Imperial College Trust, so it's difficult for us to comment.
But you know about, these systems are supposed to join up.
Well, so as Tony explains, the ultimate aim is that the systems will join up. I think the problem that you've mentioned is a slightly different one, and that relates to the teething problems from moving to a well-known IT system that the staff know well enough to be able to input patients' details really quickly, and the transition it requires in terms of speed and getting to know the system, which means there's an initial phase where it can take longer to book patients in and for the clinicians to get familiar enough to pull results off quickly. But they will get there. I've certainly worked at a trust that's implemented Cerner before, and there was a very clear transition time where everything just took a bit longer, and it just took a bit of time for people to become familiar with the system. And we're working with Cerner to monitor that, and they put additional staff on the floor to help reduce inconvenience for patients and support the staff.
so in summary on the IT, it's something that's very important to us. I would say it's one of the key things that we see strategically. Information flow improves patient care and patient outcomes. It is the non-clinical lead is a substantive NHS appointment, but there's a lot of clinical engagement in this because we recognise how important it is.
So I should just declare it interest. I've been in the IT industry for more years than I care to remember. Okay. And I've done everything from system generation to coding. I still write code and everything like that.
Right.
Yeah. Okay.
Thank you for that question. Daniel?
So that was part one of